wound up going to the ER over at St. Tammany's, our local one, and they took me right in and sent me to the hospital, and I was on life support.
So we're with Miss Mary right now. This is one of our early patients in the CHF trial. So we're in her home where we've conducted a lot of care.
My name is Mary Bahn. We moved here 7 years ago from Houston, which was a retirement from New York City, where I worked for City University of New York.
So CHF, congestive heart failure, we started a pilot program where we work with a bunch of different entities like cardiology, primary care, physical therapy, occupational therapy, cardiac rehab. We kind of put an interdisciplinary team together to reach out to these patients in their homes and deliver care specific to congestive heart failure.
They sent therapy workers to help me with my balance. My husband wouldn't let me go upstairs until they okayed it, that they practiced my going upstairs, walking, all kinds of a little bit of strength training and stuff, and making sure that I was okay, I wouldn't fall over. And so I'm doing so much better.
Yeah, so the benefit of coming to people's houses is that we're coming to people's houses. They don't have to get in a car, they don't have to drive. A lot of our patients don't have transportation, or they might live in Franklinton or even north of that. We've had some of those folks. And we can really get into their home and assess how they're living, what their diet is. Do you have pizza in the fridge? Do you have something salty that you're not supposed to be eating? So we can address those things all while having the convenience of having nurses, nurse practitioners, therapists come into the home and really nail down what their day-to-day is so that we can best address how we can help with the congestive heart failure.
I want to do lots better. Actually, I still don't have the energy I wanted to have, but I'm hoping that'll come and hoping to get better and better, and as Ornish says, undo it.
So we approach every patient, especially Miss Mary. She was early in our program, but some of the goals stay pretty consistent. One is education. That's kind of the foremost of what we've tried to do, is educate people on what is congestive heart failure, what can you do about your congestive heart failure, what are all these medicines that you've been sent home with. Education is typically the biggest intervention that we make.
It's wonderful, and they give me all kinds of insights into things to do. They help me to find the doctors. In fact, they called I don't know if I should mention the Ochsner 65 Plus, but they called over there to get me the appointments with the doctors that I would need.
I think the takeaway, like we said today, was, congestive heart failure, it's scary, it's life-changing, it's a big diagnosis that carries a lot of weight with it, but it's not the end of the world. We can treat it, especially St. Tammany with this new program. We have the capability to work with your current care team. We have the capability to bring care into your home, and we have the capability to really, change the outlook, change the outcome of your care journey.
Keep up with it and keep it going, and because I think the longer you do it, the better your outcomes.